Scanning through social media and YouTube videos, I came across a video by a breast surgeon who underwent breast cancer treatment herself. What struck me in a surprising way about this particular video was the statement which this breast surgeon made. Let's find out what she said. As a breast surgeon, she wished that she was aware of all the collateral damage that breast cancer surgery can give. If she, as a health professional who treats breast cancer, was unaware of the collateral damage, then I thought perhaps many women who are diagnosed with breast cancer may also not be aware of such an issue. So this video is to empower women with the information that they will need as they make decisions for breast cancer surgical treatment. In another video, I have covered 3 issues related to mastectomy and implant reconstruction, which is the primary operation that this breast surgeon underwent. Here, I will cover a few more problems that a patient may encounter if she were to undergo mastectomy with implant reconstruction. However, before I proceed, I wish to make a few points clear. If you have been given a choice of whether to undergo breast conservation surgery or mastectomy, please be aware of this statement made by an expert panel that breast conserving surgery with radiation therapy is usually the best treatment option. In my experience as a breast surgeon, I see the reality of the benefits of breast conservation treatment and would echo the panel's opinion and advise breast conservation for eligible patients. However, since the surgeon we are referring to underwent mastectomy and implant reconstruction as her primary surgery, I will focus on this type of operation and present the issues reported. In another video, I have discussed the research data which demonstrate that, comparing it with breast conservation treatment, mastectomy with implant reconstruction is associated with higher complication rates, poorer breast satisfaction and quality of life scores, and carry a potential risk of breast implant-associated anaplastic large cell lymphoma. The link for this video is provided in the comments section below. In this video, I plan to go into detail about the types of complications which a patient might encounter. In doing this research, I have to confess that I was surprised myself at the high percentage of women who encounter complications after mastectomy with implant reconstruction. I believe that it surprised me because 85% of my patients undergo breast conservation treatment, where surgical complication rates are 2.1%. Under my care, those who undergo mastectomy have such large tumors that it is inadvisable for them to have reconstruction due to the likely requirement of post-mastectomy radiation. So in my practice, mastectomy with implant reconstruction is very rare. Having said that, it was my impression, as indicated in this 2016 study, that complications occur in 5.5% of women who undergo mastectomy with implant reconstruction. It was therefore quite a rude shock to me that in this 2026 publication, surgical complication rates were vastly different. Of the 55 patients who completed the necessary questionnaire and were included in this study, there were 104 recorded complications in 95 breasts, or 36 patients. This meant that complications occurred in 58.9% of breasts which were operated on and 65.5% of patients. In summary, more than half of the patients in this study encountered some form of complications, the list of which is included here in this table. I thought that this must be an unusual occurrence because I would still like to believe that in the year 2026, surgical complication rates would be lower. Unfortunately, this was not to be. In another study published in 2026, this team of American doctors found that the cumulative incidence of postoperative complications was 63%. In other words, of the 400 women who were included in the study, 252 women suffered some form of complication over a period of 3 years from the time of their surgery. Still reeling from the high complication rates reported in 2026, I continued my research. I came across this study conducted in Turkey. Using a different brand of implant, complication rates were reported to be 25.4%. Using another brand of textured implants, complication rates were still reported to be 49.4%. I had originally intended to explain the potential complications of undergoing mastectomy with implant reconstruction in some detail. However, Due to the unexpected findings of high complication rates in 2026, I researched and presented additional data to ensure that high rates were not an aberration and limited to a single center. Unfortunately, as we see, similar high surgical complication rates with mastectomy and implant reconstruction occur in several centers across multiple countries. This has taken a little more time, so I will explain the details of complications in another video. Just to recap, if you are considering undergoing mastectomy with implant reconstruction, please be aware that data in 2026 suggests that complication rates for the procedure range between 25.4% and 63%. In the study conducted in Australia that I referred to, this is the list of acute complications, or events which occurred within 1 year after surgery, and this is the list of long-term complications, which occurred and persisted for more than 1 year after primary surgery. As mentioned, I will be elaborating on these issues in another video and hope that you will join me there too. Thank you for staying until the end of the video. If you have found the information useful, please like, share, and subscribe. As always, the references for the studies presented are available for you to verify. Also, feel free to include in the comment section your questions or any other topic on breast cancer surgery which may be of interest to you. I will do my best to address all those issues. I look forward to sharing more details on my favorite subject with you soon. Until we come together again, take care.